You've made it a whole 19 weeks, almost halfway through.
It's a long time.
Growing and making a whole human. You deserve an applause. You're doing a great job. I'm Shannon. I'm a certified nurse midwife, and today we're going to dive deeper into what's going on, and big things are happening. Without further ado, let's get going. You have 147 days left until your due date. That is phenomenal. It's been a while. You're 19 weeks into this journey. Smell, touch, sight, taste, and sound are developing. Your baby is swallowing amniotic fluid, and the smell and taste of your amniotic fluid can be influenced by your diet. So keep that in mind whenever you're eating and drinking, that your baby may be getting a little taste.
To eat a whole cake.
You're about a week away from having your anatomy scan. Depending on how your OB visits have fallen and how your weeks have gone, you may be getting that this week. It's usually aimed around that 20-week mark, so we can look and make sure that the heart and the spine and the lungs and the brain and the stomach and the kidneys, all those things are looking good and they're right on track. Like we've talked about, all the baby's organs are grown. They're just developing. Your baby has now a coating over the skin called Vernix. Vernix is like an oily, greasy substance that helps to keep the skin moisturized during the remainder of the pregnancy. And as you get farther along in the pregnancy, closer to your due date, that covering will kind of start to absorb or come off in the amniotic fluid. And you may still see some on your baby at delivery, but most of it by 40 weeks will be gone. The baby's nervous system is developing, and now movement is not going to stop. Some women may start to feel it by this point.
Baby kicked.
It may take a little bit longer for that to happen. Just be reassured that it's happening. And as your baby gets bigger, as your baby gets stronger, you may, and very well, other people may start to feel your baby move from the outside. Now, speaking of size, your baby is just over 6 inches long and half a pound. That is about the size of a Magic 8 ball. So we're making progress. The symptoms should be getting better or are better. Definitely better than they were first trimester. Probably better than they're going to be in the third trimester. This time in the second trimester, women are going to feel about as good as it's going to get. Hopefully you don't still feel bad. Some common questions that women will have during this time is, why do I have so much energy, and is that okay? And about dehydration, especially during summer months. Some women get concerned about whether they're dehydrated or not. So the energy burst during this time frame is completely normal, and it is a welcome change to how you have been feeling. Dehydration is and can be super common in women and can cause some cramping. Make sure that you're drinking, at least 10 glasses of water a day. I try to encourage close to a gallon of water a day. Because if you fall short, you're still in that good range. Some common symptoms that women may feel during this week of pregnancy are leg cramps and dizziness. Leg cramps can be from the increasing weight on your legs of your growing belly and baby with the amniotic fluid, the increasing mass of the placenta. So that can be normal. Dizziness is experienced by many women and can be caused by decreased blood flow to the brain. That doesn't mean that your brain's not getting the blood flow it needs. It's just a lot harder for your body to pump that fluid up past the uterus to the upper parts of your body. Make sure that you're staying hydrated. Water is so important for many vital functions of the body. Make sure that you're eating a nice, round, healthy diet. That can help with leg cramps. That can help with the dizziness. If you are anemic and you're on iron supplements, or you're just barely anemic and your provider has told you to look at your diet and work on your diet, make sure that you are getting extra iron in as needed. But if the dizziness doesn't get better despite what you're eating, despite what you're drinking, despite you taking your iron, let your provider know so they can look for anything else that may be going on. Leg cramps, same thing. Do leg stretching exercises. Make sure you're hydrated. Make sure that you are eating a well-rounded diet. And if you notice any redness or swelling in one specific area or pain when you move your leg a certain way, let your provider know. That could be a sign of something else more serious going on. During this week, when you come to your OB visit, you can expect to have to leave a urine sample. Make sure you get your blood pressure taken to make sure that's good. Check your weight to make sure that you haven't gained an excessive amount of weight or that you're gaining enough weight. Then you get to listen to your baby. Again, the most glorious sound, and it just kind of gives you that reassurance that everything's going okay. During this visit, it's a good time to talk to your provider about any questions that you may have, concerns. Make sure that everything is going well, and what should you expect for the next visit in your pregnancy? What should you expect for your baby's growth, movement, things like that. I hope this information is helpful. I hope you guys have a great day. If you have any questions, concerns, comments, drop them in the box below. Like and share this video, and have a great day.